We implemented a new EPIC sepsis workflow developed by a multidisciplinary team including ED physicians, nursing, care management, EPIC, and Guthrie analysts. This workflow improves the identification of sepsis using AI to ensure timely and appropriate treatment to enhance patient outcomes. The AI evaluates 60+ components to continually update a sepsis score that can be monitored by providers and virtual nursing. The screen shows the track board that the emergency physicians view, and a similar list is also viewed by the virtual nurses in the Pulse Center. There is a column for the sepsis score that can be monitored and determine whether a patient is low risk for sepsis, moderate risk, or high risk. You can see by the colors, green would be low, yellow would be moderate or a watch that they want to monitor, and the red likely to be septic. Obviously there's still clinical judgment that needs to go into the final decision. They can hover over the score and see the 60+ components that are being used to identify a patient that might be septic. And this is a test patient, so there's not a lot of data provided. If the Pulse Center is monitoring the scores, they can communicate through secure chat with the providers and nurses to follow up on a patient that might be septic that a workup has not been started yet. Once a patient is identified as septic, they can go ahead and identify them as a sepsis alert, and they can also start a clock to monitor timing for treatment. Once they do that, there is a sepsis list that the patients go to, and they can monitor their treatment with labs, fluids, blood culture, and antibiotics. So again, there can be communication between the Pulse Center and the providers to be sure that orders are getting placed, acted upon, and resulted.